Hello, everybody. I'm Mario Liniades, and this is The Art of Science. Today, we have a joint broadcast. I'm broadcasting from Rio de Janeiro. And on the other side of the line, we've got Dr. Florian Kongoli, still in Japan. This is why this is The Art of Science Japan. But before we have the opening video here, we'd like to talk a little bit about our sponsor. It's SIP, Sustainable Industrial Processing Summit and Exhibition, and it's sustainability through science and technology from the 27th of November to the 1st of December in Hilton Phuket Acadia Resort and Spa in Phuket, Thailand. For more information, floatin.org/SIPS 2022. Well, let's get to work. Let's watch our opening video here, and we'll be back with Dr. Florian. Good morning, and thank you for your audience.
Peter, Osamu.
Hello, Dr. Florian. How are you? Good morning. I mean, for you, it's not good morning. For you, it's good afternoon, right?
Yes, no, actually, it is we are in the evening.
Oh, it's evening
we have
already.
12 hours difference.
Oh, yeah, 7:40 p.m., right?
Yeah, 7:40
well,
p.m.
for me,
here,
it's
7:40 a.m. there.
Yeah,
Correct.
exactly. So, today we have a very special show, yes, because usually the art of science, you show something related to art, but today it's very related to science. And I would like to
Today is
have
science,
you science, and of course the beauty and the art of life, because now today you have one of the most relevant specialists in cancer treatment with a very innovative cancer treatment. You have a guest. You have Dr. Osamu Kimura, and he's going to be talking about his novel immunotherapy treatment of cancer. And he's been cited as nothing but spectacular by Dr. Adan Rios from the University of Texas, McGovern Medical School. So nice to have you here and show us around. Where are you exactly now?
I'm just entering to the office to Tokyo CA Clinic, where Dr. Osamu Kimura is the director. So I'm just entering there, and I'm just getting inside. And it's a pleasure to meet you, Dr. Kimura.
Welcome.
It's I've heard a lot about you, and it's a pleasure to be with you face to face.
Yes, welcome. Yeah.
It's a pleasure, and we are at Tokyo CA Clinic.
Very good.
It's a very, very particular clinic, and we will explain why. It's a revolutionary treatment of cancer, which is completely different from what we say. So in the beginning, we're going to enter a little bit to the office, where to the meeting room, and then we can have just a simple chat. We're going to see. Nice to meet you. These are the colleagues of Dr. Kimura.
Yes.
We'll have a short discussion here. You can probably stay here and explain a little bit what really the new technique is. What is important is that cancer classically has been treated with chemotherapy, with radiation. These are all classical techniques. Here we have a completely different technique, which kind of revolutionized the way of treating cancer. And this is the immunotherapy. I'll leave the doctor to explain, but the idea is completely different. The way of treating is completely different, and the results are really, as you said, spectacular. While quoting the University of Texas MD. So, Professor Kimura, explain a little bit of this technique, which is actually it's immunotherapy, treating cancer with immunotherapy.
Okay. First of all, welcome, Dr. Florian.
Thank you.
And I'm so glad to see you here in my office. And, yes, what I'm doing here is quite unique. Uh, it's a main the state-of-the-art procedure we are doing, especially for patients with advanced cancers. And uh, almost all patients were once given up by the treatments, yeah, the treatments by the doctor. So disappointed. I saw many people, many patients who were suffering from advanced cancers, and we developed the treatments. And to establish effective anti-cancer immunotherapy, it is very important uh, to do these things written there, reading many basic medical science paper, research paper, clinical research paper, and watching patients' problems and responses, and thinking pathophysiology behind the symptom. And if we lose patients, we should analyze the cause of the patients, why we couldn't save patients. And those things so inductive approach, because the medicine is inductive approach patients, not so um, pure science like statistics or physics. So we have to look and see so carefully the patient because the answer is in the patients. But we have to produce some new things based on basic science, right? So we are always reading basic research textbook. And every time we see some new things, we feel uh, taking care of patients. We have to uh, look all the system,
Dr. Florian,
all the
sorry,
kidney
the,
cells,
the audio is
like the
cutting a
system.
little bit.
Okay?
The audio is cutting a little bit.
Yeah,
Okay.
I don't know why, but from the past seconds, 10 or 15 seconds, we started losing the audio a little bit.
Just a
Um,
moment, because it's important what the doctor says.
yeah, of
Uh,
course, but it got a little bumpy.
what about now?
But
Just,
my voice?
I, I
just a
think
moment.
I think if you
Yes.
get the camera a little bit closer, the microphone a little bit closer to
Yeah.
Doctor.
Okay. Okay. So you can probably get closer. Just let me see the options here.
Yeah. Okay, you can go ahead.
Yeah.
Continue. Sorry.
Yeah.
And many anti-cancer immunotherapy trial, special trial, they wanted to kill cancer cells only. But it is also true that the cancer cells can grow with the help of our immune system. So we have to analyze everything. What is helpful for the patients or what is helpful for the cancer cells in the field of the immune system. Okay, so the cancer is a disease of the cell abnormal metabolism and change their behavior, but also the disease of the immune system. Okay, and to do so effective anti-cancer treatments, there are so many steps we have to consider. Okay, and this illustrates the basic concept of the anti-cancer immunotherapy. And in the core, the first of all, yes, we have to do induction of the cancer-specific killer cells to kill cancer cells. Okay, and to do it, we have to use antigen-presenting cells because antigen-presenting cell is like a teacher to teach our soldiers, our yes, killer cells, about the information of the cancer. Without that, no effectiveness we can get. But that's not enough. Those things were elucidated in my clinic. And as you can see, the key components of our treatment is from A to D. We are doing every steps by this order. The first, controlling patient's innate immune system. Without this, the response we can get appropriately and enough. B, controlling cancer microenvironment. Yes. In the cancer microenvironment, there are so many hurdles, like a barrier to kill cancer cells. So we have to control it. Without it, inducing cancer killer cells almost impossible. And C, low dose radiation. Yes, radiation therapy, almost all people believe radiation can kill cancer cells. But our way is quite different. We use only so low dose radiation to induce cancer cells immunogenicity high. Okay, if cancer cells immunogenicity so low, killer T cell can't find cancer cells. So we need to make cancer cells so easily foundable by T cells, killer T cells. So it is inevitable.
So basically, for the general public, the T cells are normally kind of soldiers. Correct me if I'm wrong.
Okay.
Are kind of soldiers of the human body that protect the human body from any microbe, any virus, and they're supposed to protect from also from cancer cells. But since cancer cells are not a foreign body coming from outside, they are not able to, they are not detectable. T cells basically sleep and then do not detect cancer cells. So you need to do this is the key point of the doctor's technology and treatment to make the cancer cell detectable to the soldier that protect the immunity of human body. That's correct.
Okay. Yes.
So this is the key to make the cancer cells detectable and then to fight them. Yeah, please.
Yes. So after that, the cancer microenvironment controlled and the patient's innate immunity controlled. Yes, we can think we should be prepared. And the next step is, yes, inducing cancer-specific killer T cells. And we are doing that by injection of the antigen-presenting cell, dendritic cell, directly into the tumor, and that is so helpful. But it is, yes, as I told you, it is very important to do from A to C to make dendritic cells working so properly and effectively to get the information, and to transfer the information to the T cells. Okay, but yes, but actually, my treatments developed from the opposite direction. Okay, and this shame, the last one is the concept of cancer vaccination, but doesn't work. It doesn't work at all. Yes, actually. So if some clinics insisting we are doing our cancer vaccination therapy and they say it's really effective, it's a fake. It's a fake. Okay, and it is also true that the cancer cells always changing their shape. Yes, yes, technical term, they're changing their clonality. And the solid tumor consists of so many clones, different clones. So sometimes it's very difficult to control all of them. But yes, by injecting dendritic cells into the tumor directly, the dendritic cells can detect the real live neoantigens of the cancer, and the dendritic cells can spread and transfer the information to the killer cells, and the killer cells can attack.
And this is one of the keys. Sorry to interrupt.
Yes.
This is one of the key of the technology of the treatment. Just to make it a little bit understandable for the normal people. What's the difference? We are injecting the so-called dendritic cell directly to the tumor. What is the purpose? To make this tumor, visible or detectable or foundable by the T cells. T cells are the cells in the human body. Everybody has those that are in charge to protect human body from viruses and any foreign agent. But since again cancer cells are coming, are reshaping our human body cells that are transformed into cancer cells, these cells are not able to detect them. So this dendritic injection directly to the tumor makes them visible, and by makes them visible, the T cells are able to fight the cancer because they know really where is the army that we have to fight. Otherwise,
So,
you will not be able to fight.
let me see if this is usually cancer cells, because they have the same DNA as us. I mean, they're produced
Yes,
by our body.
exactly.
They're
Exactly.
invisible. And now
Exactly.
injecting the T cells into the
Injecting
cancer
by
cell.
dendritic cell makes
see.
him visible to T cell that protects body.
Very amazing. This is like
This is amazing. This is
yeah.
the key point. Now, this is the concept. Then it is a whole procedure to achieve that. And then I let the doctor.
Okay.
So I'm trying to vulgarize it for the general public.
Okay. So I can show you the example. Yes. As you can see,
This is the result. Very important. Look at this carefully. Look at this.
Yes.
This is amazing.
this patient I saw almost 5 years ago, and he was diagnosed so advanced.
If I would suggest to raise a little bit more, because
Okay.
yeah.
I'm sorry that I'm.
No, it's okay, but it's because of
Okay. I saw this patient 5 years ago, and he was diagnosed stage 4, so advanced prostatic cancers. He had so wide bone metastasis everywhere of the vertebrae and skull and femur. So many severe bone metastasis.
So the black points in the left are bone metastasis, cancer bone metastasis because of the prostate cancer, correct?
Yes, and yes, every doctors told him there were no way to do effective treatments, and all the patients can do was just go home and wait to die. And at last, he came to me because he was the father of my staff. So I injected dendritic cells into his lymph node metastasis and gave him so small amounts of nivolumab. I did only that. And 2 months later, the tumor marker PSA, which was elevated to 825, the normal range below 4.0, decreased 0.3, and all tumors gone.
This is huge.
But yes,
Dr. Florian, how long did it take to have this change? I missed it. Dr. Florian? Dr. Florian, can you hear me? Dr. Florian? Can you hear me, Dr. Florian? Dr. Florian, can you hear me? I lost the audio. Dr. Florian? Can you hear me, Dr. Florian? Dr. Florian? We are experiencing a technical issue here. Meanwhile, I'd like to show you guys a video from SIPS, the Sustainable Industrial Processing Summit, an exhibition that is going to be taking place in Phuket from the 27th of November to the 1st of December. Let's take a look at it. We are back to the art of science. Dr. Florian, can you hear me? Dr. Florian? Dr. Florian? Can you hear me, Dr. Florian? Dr. Florian, can you hear me? Well, this is the art of science. We're experiencing some technical issues with our contact with Dr. Florian Kongoli, and we'll be back soon. Meanwhile, just get to know a little bit more about Phuket, and we're going to show you guys another video that shows the beautiful Phuket that you're going to experience and visit from the 27th of November to the 1st of December.
Mario, we hear you.
Well, we are back with the art of science. And Dr. Florian, can you hear me now? Dr. Florian? We are experiencing some technical issues with the connection with Dr. Florian Kongoli from Japan. And we'll be back soon. Meanwhile, as I said, this art of science is sponsored by SIP, Sustainable Industrial Processing Summit and Exhibition. Sustainability through Science and Technology. It's going to be taking place from the 27th of November to the 1st of December at Hilton Phuket Acadia Resort and Spa in Phuket, Thailand. For more information, just visit flogen.org/SIPS 2022. Can you hear me now, Dr. Florian?
I hear you. I hear you all the time.
Very good. But we missed your audio here. But good that we are back. So sorry to interrupt. If you could ask the doctor to continue.
Switch off the microphone from the second camera, please.
Oh, there is only one microphone open.
Okay, I'm bringing it down. Let's continue.
Okay.
Probably we should restart.
Yes. Ask him to continue, please.
Okay.
Dr. Florian, can you hear me?
I hear you very well. Just
okay. Very good. So we'll be back in a while. Just some adjustments that need to be done because of these technical issues we've just had, but Dr. Florian is having everything ready for us. Oh, there is Davis. Hi, Davis. How are you?
Hi, how are you? Can you hear me?
Yes, perfect. Nice to see you
Good.
there. Davis is traveling with Dr. Florian, his manager at Flogen, and he's on the team that is organizing SIPS 2022. So, Dr. Florian, could you please switch the camera because it's upside down, the camera.
Yeah,
This camera, yes. Exactly.
Mario needs the camera to be fixed. It's upside down.
It's okay now?
Is it
Yeah,
okay?
no, not yet, not yet. It's I mean it's twisted. It's portrait instead of landscape.
It's portrait instead of landscape.
Here it is landscape.
Can you hear Dr. Florian, Mario?
Yes, I can hear Dr. Florian perfectly, loud and
All right.
clear.
I think
But
it
while
was the
you adjust
landscape.
this, I'm going to Dr. Florian?
Yes.
Yes, okay. Yeah, now it's perfect. Now it's perfect.
Now it's perfect. Okay.
Yeah, but just raise the camera a little bit. I mean, yeah. To your left. There, Dr. Florence. You can stop there, please.
Okay.
Just leave it like this. Exactly like this. Oh, no.
Okay.
Yeah, okay. Good enough. Okay. Very good. So let's continue.
We have to recap now. We have to recap because it was a very interesting point. So we're missing, I don't know, probably it was the Wi-Fi or there was something wrong.
Well, this
So-
technical issues happen. This is the cost of
Yeah, I know
going
exactly.
live.
It didn't happen with
Yeah.
us before, but that's okay. So
Okay, the camera is just a little twisted, inclined. If you could incline a little bit, if you could lower the left side. Yeah, okay. Okay, Dr. Florian. There, stop there. It's perfect like
Okay.
this. Very good. So ask the doctor to continue, please.
yeah, well, I'm gonna do a recap.
Okay.
There's something with the phone.
I'm
Well,
gonna do a recap now.
Okay, please go ahead. Can you hear me?
Yes.
Okay, so go ahead.
Recap. Very short. Very important. All technologies today in cancer treatment are based on chemotherapy, radiation therapy, and they continue for years and years and years. And the purpose is not to kill the cancer, to stop its development. The person never, cancer never disappears from the person. It stays where it is. The purpose of all this treatment is to keep it static and not to develop further. Why? Because of the nature of these technologies. Here, Dr. Kimura has developed a revolutionary technology. It's called immunotherapy. It works completely different. The principle is completely different, and the way it works is completely different. The key point is for normal people to understand is that each human body has a particular organism, the T cells. These are like guardians of human body. They fight the viruses and any other foreign, kind of coming to the human body. However, human cancer cells are the origin of cancer cells come from the body itself. As such, they are not detectable from the T cells, which are the guardians of human body. So as such, T cells basically sleep. They are not able to detect the cancer cells. And here, where Dr. Kimura has developed this revolutionary, treatment of cancer, because he is able to inject dendritic cells at the tumor, and this injection, just a small injection exactly at the tumor, this makes the tumor or cancer cells visible to the T cells, the guardians of human body. And now these T cells are able to fight the cancer, not to keep it as it is at the same level, not to develop further, but to kill it. Did I explain right, Dr. Kimura?
Yes, thank you, Dr. Florian. And yes, as he explained, it is very important to induce patients' cancer-specific killer T cell. But yes, as you can see, it's not enough. In the tumor, yes, there are many cancer cells, but other cells, immune cells also exist to protect cancer cells. So if we want to erase tumor, kill cancer cells, we have to yes, attack cancer cells, but also we have to do control um, in the tumor immune cells, and those cells are working as a sign of immunosuppression. So without controlling those immunosuppression cells, we can't get a good response. Okay, and yes, for example, yes, we are using, of course, anti-cancer drugs, but the difference is the dose. Yes, as you can see the graph, if the dose so high, the chemotherapeutic agents can kill cancer cells and normal cells. But if the dose is so low, those agents can't kill cancer cells and normal cells, but yes, they can stimulate immune response. So we are using these kind of phenomena to control cancer microenvironment, which is inevitable to kill cancer cells, especially for the patients with advanced one. Okay.
Is this clear, Mario?
Yes, it is. Yes, it is. Excellent, as a
Correct.
matter of fact.
Excellent. Yes, this
So
is
it's clear for the
I
general
don't know if you
public.
have told the doctor that
Yes.
I
and
have an exact situation like this in my family.
Okay, we're gonna
Yes.
go to your situation later. Yes.
And yeah,
This
because
is
and
an
I'm
example.
impressed. I'm really
Yes.
impressed.
yes, the patients had suffered from intestinal malignant lymphoma for over 16 years, and some university hospital, so famous one, tertiary center, but they can't control the growth of the tumor, and she was dying. But she came to me at last, and I checked her data for 16 years, and I found, yes, she already successfully induced her cancer-specific killer cells. So my advice was to control her cancer microenvironment, and I gave her only one pill. And only one pill is very useful, helpful to reduce the number of regulatory T cells, which is in the tumor and protecting cancer cells. And in only 1 month, her tumor all gone. I did nothing to kill cancers. Yes, for this patient's target was the immune suppressive cells.
So you count, just for the general public, sorry, doctor. On the left, you see so many black dots that has cancer metastasis, and on the right side, you see that most of those have gone. Is this clear, Mario?
It's fantastic, Dr. Florian. I'm
It's
really
fantastic,
impressed.
correct. I
I'm
agree
really
with that.
impressed. Serious.
Yes.
Yes, today I can't explain all of the important things, but yes, as
Oh, Dr. Florian. Dr. Florian.
Yes.
this
Tell him he doesn't
this
have to
kind
explain
of
everything today,
breast
but
cancer
we are
can
looking
easily
forward to having him on tips.
erased and disappeared in 2 months, and she can live almost 3 years with cancer free. It's not difficult.
So these are only examples. So we're not going to go to the details of the treatment. It is better to show the examples how this has been. What are the success stories? He's suggesting that in order to people are very interested to see the success stories.
Yes. Yes. And there is also yes, this paper simulate the Star Wars, the dark side of immunotherapy. Yes, the author described in this paper as anti-cancer immunotherapy is getting popular and popular, but pancreas cancer is quite different. It's not a candidate for anti-cancer immunity, but yes, in my clinic, so advanced pancreas cancer, I can erase them all in 2 months so easily.
What you see in the screen is the tumor marker went from 127 to 20 in about
2 months.
It's impressive. It sure is impressive.
Yes, it is impressive.
There is so
And
many.
he said it's one pill,
Yes.
Dr.
Well,
Florian.
depends. It depends. It's not one pill. Depends. It's a treatment.
Uh-huh.
It's a treatment, but this is specific to each person.
Okay.
That's why we inject the dendritic cells. So it is a treatment. Depends. Could be simple, but the doctor can explain because he's asking. It's always one pill.
No. We have to combine so many pills, and it's different from patient by patient.
Yes, that's what I said. So I understood correctly.
Oh yeah, okay.
Okay, good.
Okay. Great.
Very
So,
good.
Please.
so smart.
Please.
And this figure shows the system of the innate immunity. I explained you about the adaptive immunity, how to kill cancer cells with adaptive immunity, but to make it work so uh, effectively, we have to control innate immunity because yes, as you can see, our innate immunity divided into two sides. One is M1 side and the other is M2 side. If our innate immunity shifted to M2 side, anti-cancer immunity doesn't work. So we need to keep patients' innate immunity to M1 side. And that's also very important.
So, and some other success stories. For example, you mentioned the 92 years old person with severe tumor.
Yeah. Yes. There are so many patients I got.
I think these are mostly people are interested.
Yes. How about these patients? 92-year-old male, and with our left sinus cancer, and he was judged by some professor in the university hospital. It's impossible everywhere in the world because this tumor is so extended, and the tumor melted the upper jaw bone and protruded into the oral cavity. And surgery impossible, and chemotherapy may be impossible for this old man, 92 years old. Radiation may be not terrible to get an effective response. But yes, in my clinic, it's the story is quite different. And yes, first of all, yes, I did control this patient's innate immunity and cancer microenvironment. 2 weeks later, the tumor, yes, quite shrink. Yes, he responded. And yes, please remember his age was 92. And during this treatment, in yes, 2 weeks, 2 weeks, he was getting better and better and getting fine, so fine. And his son so surprised to see, yes, his father got recovered completely. No. They're still cancers yet. So I told them, yes, let's do induction of his cancer specific killer T cells. And 3 weeks later, 3 weeks later, the tumor all gone. So it took 5 weeks to make all gone. So maybe you can see that something happened there is quite different from the usual standard chemotherapy or standard radiation. No, quite different. But yes, I can cure so effectively with no side effects almost.
And any other example you showed?
Yes, and yes, for example, yes, this is lung cancer patients. Lung cancer, small cell lung cancer, and it's the most difficult one. And yes,
And you see, Mario, you see the black dots.
Yes,
Black
Dr.
dots.
Florian. Yes.
yes,
Perfectly.
he had
Perfectly.
lung cancer and bone metastasis and lymph node metastasis, systemic metastasis, and but yes, doing innate immunity control, the tumor marker getting down, and low dose radiation, and in 5 weeks, The tumor all gone.
Or 60 years old female, 68 years old.
With minimum side effects like a skin rash or itching. And yes, she's so fine.
And then any other example.
And
Other success story.
so many successful. This, yeah, the control, yes, 44-year-old female with breast cancer, so advanced with lung metastasis, bone metastasis, liver metastasis, skin metastasis, and maybe every doctors in the world will give up the treatment for her. But yes, doing a dendritic cell injection or controlling her innate immunity, cancer microenvironment, yes, 3 months later, almost 90% of the cancer cells gone, and she's still fine. Yes, 1.5 years passed. So, and she's getting better and better without any hair loss or without any so exhausted situation. Yes, yes. The patients in my clinic got so fine just after starting the treatments. Yes, so it is also important not to injure patients because if some injury happens, patients have to recover from that injury, and the recovery from that injury makes immunosuppressive side of the immunity can make some barrier around the tumor cancer cells. So it is very important to take care of not to injure the patient's body, tissue, cells, organs, and that's also another key points.
So there are no type of side effects that we hear happening in chemotherapy or in radiation therapy. Here do not exist or very, very minimal, correct?
Yes.
Now, Dr. Florian, let me ask you a question.
Yes.
Please ask the doctor a question. This kind of treatment,
Maybe you can see.
how long
just
does
one.
it take? I mean, the patient goes to the clinic, and I mean, what's the process? He takes the injection, goes home, he stays in the clinic. What is the process?
Yeah.
The
He's asking
treatment.
what is the process, how long it takes, and how it looks the process. The process of treatment. The treatment.
Uh-huh. Well, yeah. The first of all, yes. That's a good question, but as I showed you, the process should be, yes. You have to do the order from A to D, and it's very important. Without this order, anti-cancer immunotherapy is so dangerous because, yes, the immunity we have two sides. So, not appropriate anti-cancer immunity may induce tolerance to cancer cells, and that may help cancer growth. So the order from A to D is so important, and the period we need is from 1 month to 3 months for the first session. But because our treatments make so little adverse effects, so it can be repeatable.
Can be repeatable without side effects.
Without side effects. So it's also the great benefits.
So 3 months you could have a visible and drastic effect of the treatment.
And
I am impressed. I have to say that.
Yes, this is impressive.
This is
This is
something
impressive.
that this is breakthrough in science because in the
Yes.
treatment of cancer. Because well, congratulations to the doctor
Yes,
because
he's congratulating you because
yeah.
he has a personal story with his father. I'm going to go later, but this is another example. A 34 years old male.
Mhm.
yes, this is the patient with mixed liposarcoma. Liposarcoma so difficult to treat, and the only way is surgical removal. Yes, and yes, for these patients, some other institution did surgery. 2015, But 4 years later, the tumor recurred in abdominal cavity, and they did repeated chemotherapy and radiation, but nothing helpful. So yes, as you can see, in the abdominal cavity, full of tumor, so hard, and estimated tumor weight should have been over 30 kilograms. And he was discharged from the hospital after he was told by his doctors his life expectancy should be less than 2 weeks. But he had the little child, and he couldn't give up, so he came to me, and I told him the effectiveness. I cannot promise him because it's so hard, but my treatment is under so rapid development. So I told him there may be some possibility that I can do something good for you. So I did. I did it. Yes, this is the picture of his abdomen. And yes, yes, please remember, yes, he was told by his doctor his life expectancy was 2 weeks. But 2 weeks after starting my treatments, his abdomen got so shrinked. And 1 week later from here, his abdomen so shrinked, and his edema of the legs are getting better, and he can, yes, he got, yes, so yeah, maybe yeah, just like normal people, and he could play soccer with his son. So
These are
That is impressive. I mean, the whole thing is impressive, but I mean, 2 weeks. He had 2 weeks life expectancy, and he was playing soccer with his son very shortly after. That is impressive. Serious. Dr. Florian, can you hear me? We lost your audio again. Dr. Florian? Dr. Florian, can you hear me? Dr. Florian? Dr. Florian, can you hear me? Dr. Florian? Dr. Florian, we lost your audio again. Dr. Florian? Dr. Florian, we lost your audio again, Dr. Florian. Dr. Florian? Well, we are experiencing a technical issue again, and we're trying to get in touch with Dr. Florian Kongoli again here. Let me see. Dr. Florian, can you hear me, Dr. Florian? Dr. Florian, can you hear me? We cannot hear you. We cannot hear you. No audio. We cannot hear you, Dr. Florian. The audio disconnected. Dr. Florian? Dr. Florian? Dr. Florian, can you hear me? Dr. Florian, can you hear me? Dr. Florian? Dr. Florian, can you hear me? Dr. Florian? Dr. Florian, can you hear me? Dr. Florian, can you hear me? Dr. Florian? Dr. Florian, we are experiencing some technical issues with your audio again. Can you hear me? We're trying to get connection with Dr. Florian Kongoli, and meanwhile, let's talk a little bit about SIPS, Sustainable Industrial Processing Summit and Exhibition, and let's watch again a break. Let's have a break here and see the wonders of Phuket again. Hello, we are back. We are waiting for a new connection with Dr. Florian Kongoli from his. We are talking about a novel cancer treatment based on immunotherapy, and our guest tonight, our guest. Let's see here. We are having a connection again with Dr. Florian.
No,
Dr. Florian, can you hear me?
We hear you.
Can you hear me?
Yes, we hear you.
Good, good. So let's go on. We had a technical issue and the audio disconnected, but we can go.
Two times.
We can go from there again.
Okay, so this is the
We lost like the final minute. Yes, 30 seconds maybe.
30 seconds we lost. So basically, the doctor was saying the immunotherapy, it is a very specific science. You know, just to mention the name immunotherapy doesn't mean that it's successful. Has to be individual, has to be cultivating the correct.
Yes, yes.
So this is what is done in this clinic. It is particularly important, correct me, doctor, if I understood it correctly.
Yes.
So not to be deceived, but just the name of immunotherapy. You have to see the procedure, and you have to see the results, and you have to see the success story. So this is the key point. And as I understand, the key point is the cultivation, correct?
Cultivation. Yeah.
Can you explain the cultivation? Then we're going to see the lab where we can cultivate. We're so sorry for these two interruptions, but apparently, we have some interferences. I don't know what kind of interference you have. We didn't have this before, but anyway, we will add it also a version without interruption to have both for people. There are those that are following us live, but also a new version that we're gonna remove the interruption and make it perfect. So, and I'm leaving the doctor now to explain what do they cultivate and how it works, surely without giving away the confidential aspects, but how it works.
Well,
You hear us, correct, Mario?
cultivation, incubation.
Yes, loud and clear, doctor. Loud and clear. Now it's perfect. Just go ahead. Dr. Florian? Dr. Florian? Dr. Florian? Dr. Florian, can you hear me? We lost the audio again. Dr. Florian? Dr. Florian? Dr. Florian? Dr. Florian? Well, we are experiencing again the Dr. Florian. Can you hear me, Dr. Florian? Can you hear me, Dr. Florian? We are experiencing some technical issues, and we are going to connect with Japan really soon. Let's see what we can do here. We'd like to excuse everybody, but there's probably an interference or whatever because Dr. Florian, can you hear me now? Can you hear me, Dr. Florian? Dr. Florian? Dr. Florian? Dr. Florian, you're muted. Dr. Florian? Well, we'd like to excuse ourselves for this technical issues. There's probably some kind of interference.
Nobody drinks.
Hello, Dr. Florian, how are you? I
Yes.
can't hear you.
Okay, now I continue.
Okay, please go ahead.
So again, we are really sorry for this. There is just somehow an interference in between cameras. We're gonna prepare a new. We're gonna leave the live version as it is, but also we're gonna prepare an edited version without the interruption because this is extremely important. Somehow we are getting difficulty making publicity and. Showing the truth for this magnificent treatment. So, but we are not gonna withdraw from the difficulties. So we're gonna continue. So, what the
Yeah, just to let you
professor?
know, well, we are using a second camera. We believe it might be the second camera that is zooming in the presentation. So we're not going to zoom in the presentation anymore. In the,
Yes,
the,
because the
the edited
presentation is
version,
finished.
yeah, in the edited version, we are going to insert the slides from the original presentation. Okay.
Correct.
So
So
we'd like to excuse all our viewers now, but as Dr. Florian said, we are going to release a new version of this interview because it's really interesting. And I would
yes,
like
it's very
the
interesting.
doctor to continue, please.
Yes, the doctor was speaking about the cultivation. This is the main point. And then we're going to see the lab of the clinic to see, sure, not in detail, how this is being done. Please, doctor, the cultivation. What do you do? How you treat the cultivation?
To tell the truth, I'm not so well informed about the detail of cell cultivation, and I always order the technicians and specialists to do to make this type of something better function to do it. So the secret to make it, I don't know, but the concepts or the direction, I always order those people to make them effect.
So this is the in to the tip of iceberg of this treatment, which has been so successful, and we saw so many examples, success stories, and this without side effect, working completely different in terms of immunotherapy and without not through chemotherapy or radiation to keep the metastasis at a stable level and not to be developed further. This uh, attacks the cancer cells, and kill them in that in a particular way because of this new technique. So we can have a short. Did I explain correctly?
Oh, of course.
Okay. So this is the key: immunotherapy and balancing and managing the relationship between the immune system and cancer cells. So and giving the right signals and the right information to T cells that protect the body, that are protection of the body to attack cancer cells and to kill them, and also managing this relation, which is individual for individual person. Normally, it takes the results can be seen depending on the person, depending on the severity of the cancer or the metastasis. Could go from 1 week to 3 months. Sometimes might go a little bit more, but what is important is that the cancer is gone. The cancer is killed. It's not assured the stability of the cancer where it is, not to be developed further, but it is killed. And this is the key point of this particular immunotherapy for cancer treatment. Any other?
Dr. Florian, let me ask you a question.
Yes, you're so smart. You can understand.
Thank you.
Let me ask you a question, Dr. Florian.
Marius has a question.
Yes. What is the percentage of success in the treatment? Of course, it's individual.
Of the treatment. The percentage in front.
Yeah. You can see the slides. Yes. Yes, initial 17 cases, the CR rate 18%, partial response 59%, and the response rate are over the SD, PR, and CR, so 82. But these years, the CR 31, and PR 55.
But in order for some of the response rate, with the term response rate is a success rate.
More than 80 stable disease response rate, and 88%. And this the character, yes, the CR, yes, complete remission rate is increasing, and I think yes, this complete remission rate is increasing more and more. Maybe in a couple of years, over 50%. I think.
So it will be more.
That's impressive. That's impressive.
Yes.
Serious.
Right. That's impressive. That's impressive.
Especially after seeing the cases he showed with metastases, with low life expectancy. So this is really impressive. Serious. It's nothing but spectacular, as the doctor from the Texas University said. The University of Texas said.
Yes, it is spectacular actually. So we can have a short visit to the lab, and then we can go and finalize this live.
Perfect.
Sure.
Okay, let's walk around them. I'm anxious. I'm looking forward to seeing it.
Yes.
Let's check
well,
it.
You'll not see too much. You'll see only the lab where they do the cultivation. But this is important for people to see that it takes time and it takes to cultivate.
Can Davis hear me?
Yes, sir. Yes, sir. I hear
Very
you.
good. Okay, Davis. So let's walk around.
So here we are in the cultivation center. This is the lab. This is lab
to check the immune response or the cell marker. We have to check all the yes, I know this the cell marker of the tumor and the lymphocytes, some of the things here. And the cultivation area is from here. Yes. And clean room there.
Can you open the lights?
So
Okay.
yes.
So this is the cultivation area.
Okay. Could you step
Not so
in,
big, but it's
Davis, so
enough
we
in
can
this
see a
small
little
clinic.
more?
You cannot step in because
I'm sorry, Mario. Can
Okay,
you
okay,
repeat?
okay. So the closer
Okay,
he
good.
can get, just to show.
Okay.
so this is the cultivation area.
Okay.
He's asking me to get as close as possible.
But nothing special.
Well, interesting.
Nothing
What's that?
special. It is
Yes,
close.
the special is the idea.
Yeah.
Okay. Very
So this
good.
is the
Very good.
cultivation area.
Show you the clinic.
And now we're gonna go to the clinic.
Okay. Wow, it's really impressive
To
there.
keep the patient's privacy,
Uh-huh.
yes, the,
Yeah, of
the
course.
waiting area is not so large. So the patients come to me and they directly into the treatment room, room by room.
So this is the clinic where patients come and they are treated. It's a nurse station.
If the patient is so bad, situation so bad, the patient can stay in my clinic from the morning to or the evening, late evening, and
Mhm.
like a hospitalization. Yes, this is the kind of this room, staff room, and infusion room,
They don't stay overnight, Florian.
and this.
They can stay overnight, but mostly no. This is because
Impressive.
there is no side effects. Correct, doctor?
Yeah.
So this is the difference. You know, in chemotherapy, you have to stay. You have to be followed. In radio, sometimes you go home also. But here you do
Exactly.
not need to stay in the clinic because the side effects are so minimal or close to zero.
So yes, mild one we frequently experience, but not severe one.
So there are minor one, but not severe one.
Yeah.
So that's why they do not need to stay
Yeah,
overnight.
yes,
Overnight.
yeah. This room is for the endoscopy and ultrasonography and yes, some surgery. Yes, I can do that with this. Okay, so small clinic.
So it's a small clinic, but the results have been impressive.
Dr. Florian, if you could ask him, for example, is this treatment exclusive of his clinic there,
This
or is
picture,
it being reproduced in other
from
clinics
a
around the
patient's-
world?
Gave us
His question is, this technique is exclusive of your clinic only?
only.
So that's correct. It is your own development technique.
Of course.
It's Dr. Kimura's developed technique developed by him. And
Okay,
it's
but it's
not
not.
available in any other places, correct?
No.
So it's not available in any other place. It's his own technique, and that's why we are here. Here you have the the idea creator and the person that made it a reality. Correct.
Yeah, the passion to save people. That's all. Yes.
So that's what he said. The passion. He has a passion to save people's lives, and with this, with the example that we've seen, really, this is something particular. So
For
we
sure.
can.
Indeed. Yes.
It's if you are able to kill the cancers. And today, doctor, correct me if I'm wrong. Today, all the classical techniques are to keep the status of the cancer metastasis where they are. The normal usual is doctors say we cannot make it less. We have to keep them where they are to avoid becoming bigger. So but this is just keeping it stable. It's a perpetual fight. Chemotherapy and treatment all their life, etc., etc. So these are the classical techniques.
The reason why they say is they can only that because they can't kill them all. But yes, if we can correct and adjust the anti-cancer immunity, yes, I believe we can kill all the cancers. So that's our goal, to kill all of the cancer cells in the patient's body. But sometimes so many hurdles, especially patients had repeated history of surgery or radiation therapy. Those things injure the body, and the body make barrier,
Mhm.
and those barriers protect cancer cells. And so thick barrier patients have, our anti-cancer immunity can break through. So I always think people with cancers have to first have anti-cancer immunotherapy.
Mhm.
That's yes. After they got immunity against their cancer cells, and next how to do next. So um, still now, most of the patients came to me after so many treatments, but
Mhm.
it's maybe opposite. That's my feeling.
Yeah.
Cancer immunotherapy should be done first.
And what's so impressive about your treatment is that when you have patients with stage 4 metastases, usually the best you can get is stable disease for a few years. But with your treatment, the vast majority of the cases are getting complete response and partial response.
Uh, Now, the
Great
percentage
observation,
of the
Davis.
CR, configuration rate, getting increased with the development of my protocols. My protocol is developing every day, and because I am taking care of the patients so precisely, and that's my work, because the answer is in the patients, not in the textbook, not in the guideline. In the patient's body, there are answers. So we have to look and see so carefully what's happening, what's the response, and the problems we have to solve. So to do that every day, hard work, but that's the reality.
Dr. Flores, so each treatment is customized. I mean, they're not
Yeah.
two
That is
patients with the
customized,
same
correct?
treatment.
He's asking if each person, each treatment is customized.
Of course, every disease quite different person to person. Yes.
It's fully customized, and that's why the time of treatment is different, correct?
Yes.
So it is. That's why we're speaking about cultivation. That's why we're speaking of it. You have to manage this relation between which only Dr. Kimura has found the relation between immunity and cancer cells, correct? And this is the key.
Yes. I don't want unnecessary treatments because yes, we have to think about the cost and effectiveness, and unnecessary drugs may be harmful. So we should minimize the cost and the kind of drugs we use and make the efficacy maximum. That's the point. I'm not trying to do. Yes.
Yeah. So
Very, very, very interesting.
this is the story of Dr. Kimura. I think this is huge possibility for the future.
Yes, I agree.
It is that's because it's not treated this way with the classical techniques. It's a completely different world. There are two different planets in this. Two different planets are treating cancer. I guess. I guess this. I have the right to say this. So in the first classical treatment, again, I'm repeating. You need to keep wherever the cancer status is, not to prevent going in further, to be developed further. Here you kill it and make the patient cancer free. Is this correct?
Yeah.
That's a big difference. So it's really it's really encouraging to be in a clinic like this because you see the light of the end of the tunnel because cancer has
Exactly.
been
Exactly.
exactly you see the light of the end of the tunnel and you know you feel optimistic for the fate of those patients that all have given up to cancer.
Exactly.
And all
Exactly.
other doctors have told them there is no more treatment, nothing he can do for you, unfortunately. So here, there is hope here. You might have metastasis all over your body, and you have a treatment.
Well,
You might have.
I'm going to be very honest. I'm impressed because, I mean, since we've been kids, since we were kids, we've
Yes,
been
correct.
listening to how difficult it is to treat cancer and all that. And this is, you mentioned it correctly. It's a light at the end of the tunnel. I mean,
Right
you're
at the end of
probably
the tunnel,
looking, we are
correct.
looking at the cure of for cancer. Yeah.
Yes,
From the
correct.
inside, I
Because
mean, with each person's immune system, right? This is
yes, correctly,
this is
correctly.
an outbreak. I mean, congratulations to to the doctor, because I mean,
He's
Dr. Kimura,
congratulating
Osamu
you for this
Kimura.
big breakthrough in treatment of cancer, and which is really something specific. So any person around the world that feels helpless,
Hmm.
that that all other doctors and all our treatment, uh, have been unsuccessful. Here they have a hope. So this is their hope. We can say their last hope, because
Hmm.
if anybody has given up, any doctor, any clinic, any treatment has been unsuccessful, and any doctor has given up to them, here they have their last chance. So do not forget this. The doctor is here, so passionate. Here is around 8 p.m. now, and then he's here with us. But this is, passion about fighting cancer, and that's why, uh, doctor, it is an honor and pleasure to speak with you, and to feel so optimistic for all those people that have cancers all over their body. Yes, everybody has given up on that.
I'm so glad to hear that.
Yeah,
Thank you.
and again, you have to come here and take a picture for people to remember. Is
Yes, of
Tokyo
course.
CA Clinic, Tokyo
Tokyo CA
C
Clinic.
Clinic, and here that the hope of all those cancer patients that have no hope from other treatments, and all other hospitals or doctors have given up.
I am
So
impressed, really serious, and
yes,
I'm looking
I agree
forward
with
to
that. It's
meeting him
impressive.
in person in Phuket.
Sure, sure. Well, we'll invite him for sure at SIPS to present this technology, because we have, in SIPS we have new technologies. In SIPS we have new technologies in medicine, and you cannot have a really new treatment and new medicine without having this. Cancer is one of the the highest percentage of uh, people that die from cancer is one of the highest in the world. So if it is a new technology in treatment, here we are. So we're going to send an invitation, doctor, to come and present this amazing, treatment at SIPS 2022 in Phuket, Thailand. It is end of November. It is this specific symposium, New Technologies in Medicine, is chaired by Nobel laureate in medicine, Professor Farid Murad. So we have 9 Nobel laureates coming. Most of them are in chemistry, but 3 or 4 of them have worked on cancer with chemical techniques, totally different from yours. So probably they should hear about your techniques. So there are 3 Nobel laureates, chemical Nobel laureates, that have been working with cancer, and the whole thing is dedicated to Nobel laureate in medicine, Professor Farid Murad, one of uh, the inventor of the uh, signaling effect of nitric oxide in the human body. That's why he got the Nobel laureate.
Dr. Florian, Dr.
So,
Florian,
yes,
we already have 9 Nobel laureates
the
at
9
SIPS.
Nobel laureates
I-
participating. So
If
it's a
Dr. Kimura goes to SIPS, I'm sure that in the future you're going to be able to say that we had 10 Nobel laureates, because this is Nobel Prize material for
So
sure.
he's saying this is Nobel Prize materials. So, but he's so modest. So he's saying that if we have 9 Nobel laureates, a little bit more in future years, probably we'll have a 10th one coming to SIPS. It's a pleasure, Doctor. Again,
Thank you.
we feel so fresh to have this technique,
I'm so
and
glad.
we wish you major success.
Thank you. Thank you. Yes.
So Mario, we finalize here, and again,
Okay. Okay.
we'll have
Thank you
an
very
edited
much, Dr.
version.
Florian. Thank you very much for this opportunity. It was really a great pleasure, a great honor to meet, to see you, and also to meet Dr. Kimura. So I'm looking forward to seeing you in person in Phuket, Dr. Kimura.
Sure.
And
In
well, this
Phuket.
is
Hopefully, Doctor, we're gonna send an official invitation to Dr. Kimura.
That's good. Well, this is the art of science today with a lot of art. I mean, not only art, this is the essence of life for science, through science. And I would like to thank everybody for the audience. And as Dr. Florian said, we had some technical issues on this episode. So we
We're
are
gonna
going to
have an
re edit
edited
it.
version without those technical issues. Apparently, there was an
Exactly.
interference between the two cameras, and
Exactly.
the sound was switching from one camera to the other. But we're gonna cut them, and then we have a clean version, edited version, besides the real time. Real time is you can never can achieve the spontaneity of real time broadcasting.
No, never.
So this is the best of real time broadcasting. Sure, sometimes you have some difficulties like this, but it's worth it to be live than to be recorded, because
Of
recorded
course.
is recorded. You can cut. You can. It's not natural. This is
Yes.
natural, and that's why here we have a real time description of a new
Yes.
technology. So we'll have both real time and an edited version for people to follow us. Again, Doctor, I wish you a good night, and we'll be in touch in the near future.
Thank you.
Thank you. Thank you. Arigato gozaimasu.
Good pronunciation. Yeah. Thank you.
Well, that's it, guys. From Rio de Janeiro, I'm Mario Linares, and I would like again to invite everybody to get to know a little bit more about SIPS, Sustainable Industrial Processing Summit and Exhibition, Sustainability Through Science and Technology, from the 27th of November to the 1st of December at the Hilton Phuket Acadia Resort and Spa in Phuket Island. And for more information, just visit flogen.org/SIPS 2022. I'm Mario Linares. I'm broadcasting from Rio de Janeiro, and it was a big pleasure having you here. See you next time. Bye bye.